Looking up here, a report, an analysis from The Guardian and Kaiser Health News indicates that over 3,600 U.S. healthcare workers, and of course this is beyond nurses, healthcare workers have died due to COVID-19 so far. Were you aware of that?
Yes,
in the
ma'am.
United States?
Yes, ma'am. That's part of the data that we looked at when we brought this bill.
And in terms of the numbers in each state, Texas is only second to New York, which had a horrific number of healthcare workers and nurses who died. Were you aware of that?
You know, I didn't know that we ranked that high, but it doesn't surprise me.
Well, I know from the discussion that you just had with Dr. Oliverson that you're aware that nurses represent the largest proportion of healthcare providers who have been hospitalized to COVID-19. Is that not correct?
Yes, ma'am.
And that as of the end of March of this year, our state had spent over $3.3 billion of our federal COVID funds just on emergency staffing alone. Were you aware of that?
Yes, and we were acutely aware of it in El Paso, where we had a very difficult situation in our community and had to bring, I mean, part of it was a staffing issue because you had clusters pop up in multiple facilities. And you know, the state was very willing to help us with resources, but it was very challenging.
And so you saw in your own community what was going on that was making it very difficult for those nurses that were there and then having to bring more in. What about what you actually experienced in your own community would tell you why this presumptive coverage is so important?
Well, like I said, this is about just setting a different posture on the playing field for families that have had to endure tragedy and people that we've all called, you know, heroes and frontline workers. And I just feel like while this is, as Dr. Oliverson pointed out, while this is somewhat of a departure from our normal scheme, this was a very unique event in which people suffered very uniquely. I've certainly sat with and talked to people in the nursing community in my hometown who were in tears about their experience during this pandemic. And so my point is very narrow here. Let's not put the burden on them as the system normally would. Let's allow them to have a presumption to begin with. And if that didn't happen in the workplace, then let's let the system figure that out, which it would anyway. But let's just flip it the other way. I think that's a very narrow favor that we can do for these frontline workers.
And we know we have a lot of frontline workers in a lot of industries that have been put in harm's way, but would you not agree that probably our nurses who are actually doing the bedside care of COVID patients, the frontline of frontline workers?
I mean, I don't think we asked more of many people than we did from our nursing community. And I know that Mr. Patterson worked very hard on making sure that other frontline responders have this presumption. And so I think it is fair that we add nurses into this conversation, understanding that, you know, maybe there is a cost associated with that, but there was already a cost paid by the nurses.
Well, as you know, we've already passed a bill out of the House on workplace violence to try to provide a safer working environment for our nurses. I'm proud of that. I think this is another step that we could take. Clearly, nurses have been there for us, are there for us, and we need to be there for them. So I know that the House clearly does support nurses. I thank you for bringing this bill, and I'm proud to be a joint author. Thank you very much.
Thank you, Ms. Howard.